Welcome back. It's Dr. Carl Baird, and today I'll be discussing a few of the ways your doctor can actually make your joint pain worse. So one of the reasons that I put this channel together is to help people make better decisions when it comes to their health, specifically around things like joint pain. So over the course of my career, one of the things I've noticed is that people are getting a lot of bad advice when it comes to how to treat and manage joint pain to live active, healthy, and happy lives. And unfortunately, a lot of that bad advice actually comes from people's doctors. People will come to me and just some of the things that they tell me that their doctor has told them is not only not very helpful, but can actually be harmful to overcoming pain. And so what I wanted to do in this video is just highlight a few of those things to help you avoid them and make better decisions about what it's going to take to help you overcome pain, live active, healthy, and happy lives. So let's go ahead. Easily one of the most common things that doctors tend to do to help treat and manage pain is prescribe pain pills and injections for pain relief. To understand why this is a bad thing, we have to look at pain a little bit differently. Pain is actually a good thing. Pain is your body telling your brain that there's something wrong and we got to do something to fix it. And so what happens if we just completely mask that signal is, yes, we do get that short-term pain relief, but we don't fix any of the things that are actually causing pain, which in the long run is going to lead to a much bigger, much more expensive problem. I like to think of pain as your body's check engine light, right? If you're driving and you see that check engine light come on in your car, you can do two things. You can take it into the shop and figure out what that is and solve it, or you can just ignore it. You can put a piece of tape over it, pretend it like it doesn't exist. The car is still going to drive. You're still going to be okay. But when whatever is causing that check engine light to go off, it's going to be a much bigger problem with a much bigger fix. And the same is true with pain pills and injections. Yes, they provide pain relief that basically just covers up whatever the problem is, and you can go on about your day, but eventually that is going to come up to you, and it is going to lead to worse long-term outcomes when it comes to this joint pain. Another common thing that doctors prescribe for pain that can actually be problematic is rest and immobilization. So they'll tell you, just stop using this area for a few months, let the body heal, and it'll start to feel better. And while that is true, studies have actually found that rest and immobilization can prolong healing time. So it can make it take longer to feel better. One of the best things you can do for any sort of pain is to get gentle, pain-free movement to help increase blood flow, ease healing, speed the healing process. These are all things that movement are really good for, and if you just don't use that area, it actually takes longer. Another side effect of specifically immobilizing joints, so again, a lot of people that I meet are just put in braces for relatively minor injuries, and this causes a whole host of problems by one, causing muscular atrophy in that area. So the muscles that actually control that joint get smaller, which is going to cause a lot of problems later on. It can cause movement compensations. If you've ever been put in a brace, you know what it's like to have to try to learn to walk in that thing. You got to change the way you're moving, which eventually gets ingrained in your body if it's left on for too long, and is going to lead to more joint pain later on. And studies have actually found that immobilizing a joint can damage the articular cartilage, which is going to lead to more arthritis and more joint pain later on. So if you have joint pain and injury, it's important to realize that rest and immobilization isn't always the best thing. Finding ways to incorporate gentle, pain-free movement, one of the best things you can do to ease pain and speed the healing process. Another common thing that many doctors do is actively steer you away from therapies that actually work. And so the reality is there's a lot of safe, natural, and effective treatments to manage and treat pain that don't rely on pills, injections, or surgeries. And many doctors, unfortunately, not only ignore these therapies, but they'll actively advise you from going to try it out. And so I'll stick with strength training, but a lot of the people that I see that come in the clinic have been told by their doctor that they've got bad knees, that they've got a bad back, and that strength training is going to make it worse. When in reality, getting stronger and building the strength to protect your joints is one of the best things that you can do. I'm a chiropractor, and I've heard from a lot of my patients that their doctor initially told them not to try acupuncture, not to try chiropractic, not to try massage because they're dangerous and they'll do more help than good, when study after study has shown that these therapies are safe and effective at treating all kinds of joint pain. And so if you are in pain, I recommend that you do try a lot of these alternative therapies to manage joint pain that are going to be more effective than pills and injections. Another thing that a lot of patients don't know is that this pharmacological approach to treating a lot of medical conditions actually cause more joint pain. So my mom was actually a medical doctor who ended up leaving the field because of this over-reliance on pharmaceuticals and pills, basically. And so if you look at the side effects of a lot of these drugs to treat asthma, cholesterol, osteoporosis, anxiety, depression, a lot of these drugs, the side effect is listed as joint pain. And so while you're being prescribed these drugs to treat certain symptoms, it's actually contributing to your joint pain. And so it's just an important thing to keep in mind. Anytime somebody comes to my clinic, the first thing I do is look at what prescription medications they're on. And if there is a way to, if a side effect is increased joint pain, if there's a way to decrease the dosage or get off this medication, is a great place to start. Another thing that many medical doctors don't acknowledge that's very beneficial in treating joint pain is the importance of lifestyle factors in things like pain. So they'll just completely ignore things like your diet, your stress, your sleep patterns. They won't bring it up as potential contributors to this pain, especially people that are living in chronic pain. And in reality, these lifestyle factors play a huge role in the amount of pain that you're experiencing, and that by improving your diet, improving your sleep, and lowering your stress, those are the three most common, are really important parts of treating and easing chronic joint pain. Another mistake that many doctors make is an over-reliance on imaging. So when your doctor doesn't know what to do to help manage or treat pain, they'll order an image, an X-ray or an MRI, and they'll use the findings of that X-ray or MRI to justify whatever treatment is next, which in their world is a lot more pills, injections, or last case scenario, surgery. But what we're starting to find is that the findings of an image don't relate to the amount of pain that somebody's experienced. This is true for arthritis in an X-ray. This is true for bulging discs in an MRI. The reality is that, let's just look at bulging discs. There's plenty of people, if you took an MRI of my back, you'd probably find some sort of slight bulge in my intervertebral discs. But I don't have any pain. And on the flip side, you can take somebody who has chronic lower back pain and they don't have any bulging discs. There's not that correlation. And so justifying more treatments and more invasive treatments based off an image is something that a lot of doctors do, but it's going to lead to worse outcomes later on, which we'll get to next. The most damaging mistake that I see a lot of doctors make is sending people to unnecessary and dangerous surgeries. So the general pattern when somebody goes to their doctor with pain is they start with pills. When those become less effective, they move to some sort of steroid injection in the joints, or if it's your shoulder, into those tendons to help, again, just kind of mask symptoms of pain without treating underlying causes. And when those don't work, they'll start looking into surgery, whether it's fusing that area or whether it's going in there and replacing that area. And what again, they're starting to find in studies is, again, short term this may be okay, but long term, if you follow up for these people that have had these surgeries, is that it doesn't do anything to help limit the amount of pain that people have. And the problem becomes is when you go in there in surgery, that's going to change how you move. There's a long recovery that's going to lead to a lot of muscle atrophy and strength. You're cutting through muscles, fascia, nerve endings that cause a whole host of other problems. And so a lot of the people that I've worked with have already had some unnecessary surgery, which is going to make it harder to kind of retrain the things and fix the underlying things that cause their pain, which surgery doesn't address. That is all I got for you today. That's just a few of the ways that your doctor can, intentionally or not, end up making your joint pain worse in the long term. So if you are somebody who is struggling with joint pain and haven't found long-term relief from pills, injections, and maybe you're thinking about surgery or you've already had some sort of surgery, I would strongly recommend looking into these safe natural and effective treatments like chiropractic, acupuncture, massage, combined with movement and strength. That's what we focus on here. By improving movement and building strength, not only do you limit the impact that goes through your joints, but you improve confidence in your body's ability to do the things that you love, to live active, healthy, and happy lives. And ultimately, that is what is most important. So thank you again for watching. My name is Dr. Carl Baird. If you have any questions, leave them in the comments below. I'm happy to read and respond. Thank you so much. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.